One. So hi Debbie, good morning. Thanks for joining us. As you know, Jake's asked us to do something about the Safeguarding Week of Action in regard to how primary care has been during COVID. So Debbie, before we start, can you just introduce yourself to everyone?
Yep, sure. Well, thanks to Jake and the Trafford Strategic Safeguarding Board for inviting us to reach out to you. I'm Debbie Cole. I'm a GP at Bodmin Road Health Centre in Ashton-on-Mersey in Sale, and also named GP for Safeguarding Children, and also doing other work at the CCG. And how about you, Chris?
So hi, thank you. So I'm Chris Tower. I'm a GP at Davy Hume Medical Centre. I'm an adult safeguarding lead at the CCG, and do other things like I'm on the board at the CCG. But yeah, I do what's asked of me, really. So thinking of the COVID time, Debbie, what do you think of the challenges been to general practice?
Well, I mean, I guess there's not a person in this country that hasn't faced the huge changes and challenges of COVID and the interesting things that have thrown into our paths. So I guess on an individual level, you know, we're all human beings as well as professionals, whatever we're doing, and we're all struggling in some way to balance the challenges of both home and work. A lot of us have health concerns for family and friends who may be elderly or unwell. And obviously, we both have children, largely teenage children now, but everyone with kids. Schools completely changed, childcare, nurseries has changed. There's so much more anxiety about the risks of going out and mixing with others. And I mean, my teenagers have faced massive disruption to their studies, universities, you know, there's lots of stress out there. So as well as that, we are both GPs, and primary care has had a lot of challenge and change. Contrary to some recent media reports, it has never completely closed down. We have tried to maintain as good a service as we can, keeping things going, but with massive changes. The government said we should do total triage, which people may have heard of, which means that we basically have to assess everyone who wants a consultation remotely initially to minimise face-to-face contact and transmission of this horrible virus. So that's largely been changing to telephone and video consultations or online consultations. But we have seen people face-to-face throughout this crisis, and we should see people face-to-face. We have still done home visits, and we have tried to maintain chronic disease management. There was a big slowdown at first, but now we're trying to get that going again, remotely, some face-to-face. We're still doing blood tests, immunisation. Really important that we're screening. There's so much concern about people delaying possible cancers being picked up. And obviously, we're here today because we have a passion about safeguarding, huge issues with safeguarding throughout this crisis, and we've done our best to keep that on the agenda too. So, you know, what do you think have been some of the big changes that you're experiencing, Chris, in your practice?
So certainly, when the government said, I think late March, with very little notice, that we had to do the total triage, so we had to speak to everyone or assess them before they came through into the building. Some practices locally had already started a platform called Ask My GP, and very quickly, within a matter of days, Davy Hume, having pondered about that for a few months, we just got on with it and made that change. So people can email a request in or text in. If they've got say an infected ingrowing toenail, they can take a photo of it and send a photo in, and then the GP can choose whether they want to speak to someone, whether they want to invite them in. Like you, we've been seeing patients throughout this time. We've been seeing less in surgery, but some people need that face-to-face contact at home or in surgery. Or the GP might just assess the photo, send a text message back, this needs antibiotics, and not need to speak to the patient at all. So I've quite liked that those that I've needed to see face to face, perhaps I've had a bit more time with. Those that are quick and easy can be dealt with by a text, because I've seen the photo, that's been straightforward. So I think Ask My GP is not perfect. However, it seems to have helped both the continuity, if you put like a particular GP, and access. So rather than waiting weeks and weeks to see a doctor that wasn't your first choice anyway, perhaps, then you're seeing someone, hopefully you're more likely to speak to the person that you want to on the day, not always. We've tried to have COVID safe consultations. So when we've assessed someone and we've worked out that they haven't got COVID, then we've when we've seen them in surgery, we've been wearing our masks and gowns and visors and gloves and all. If they've had a bit of a temperature, we've had a separate part of the building called a hot room or a red corridor where we've seen someone. And indeed, the CCG have commissioned master call to see some of these patients now who may have COVID outside the building, so that we are mainly seeing those that we don't think have got COVID in the building. Alongside that, though, we've had to do the normal stuff like get on with our flu jabs. Flu jabs, rather than seeing, we used to see about 20 people an hour per clinician. You could do for flus, but now with social distancing and cleaning the rooms and all that, it's a lot slower. So we've still had to do the normal things like try and get everyone vaccinated. I think too, a lot of what's changed is that so I'm married to a secondary care consultant, and they've had huge change as well, and they've had to deal with emergencies, the COVID things, and a lot of the planned operations have been paused. And so a lot of what I do is managing that when a patient isn't unfortunately able to get their operation, or they're in a waiting list, or they haven't heard, they're coming to us as GPs and trying to manage the expectations that the hospitals have got a backlog, they've got a plan, they will work through it, but unfortunately people just have to wait to be contacted by the hospital, or indeed if they're getting worse, then I can write and try and speed up their appointment. So I think I would say that before COVID, I'd probably see 30, 35 people a day and speak to 5. I think in April, when the government said, don't see the people in surgery unless you have to, I was probably only seeing 1 or 2 or 3 people a day in April, but speaking to 30 or 40 or 30-ish probably. Now I'm probably seeing between 2 and 10 people a day, but still speaking to 35 or dealing with their inquiries. So I agree with you, Debbie. We are seeing patients face to face, but those that can be dealt with remotely, we're continuing to do. So Debbie, if I could just ask about what sort of people you see, what sort of things are people coming to see a GP at the moment? What are the consultations mainly like?
Yeah, sure. I mean, I totally agree about the level of demand we're getting and the need to chase up secondary care. Obviously, we've been talking about all the stresses that this crisis has thrown everyone's way. We're seeing tons of mental health consultations. And at one level, I guess anxiety and depression about what's happening in the world at the moment, politically, environmentally, and obviously with the pandemic, you'd expect to have some anxiety and depression. That's a kind of normal response, but we're seeing a lot of people who are really struggling. Obviously, there's been lots of anxiety about the need to shield, the isolation that brings, the anxiety of then going back into society, going back to work and school, the mixed messages, the confusion about what we actually should and should not be doing, what is safe. We've had more bereavements to deal with. You know, I mean, obviously, I know several patients who I've lost, who I've looked after for many years. So families are losing loved ones, and obviously coming our way when they're struggling to come to terms with that. There's been lots of stuff in the media about care homes, and care homes are in a very difficult scenario, limiting the ability to visit your loved ones. And we've had some really sad situations where COVID's got into our care homes in Trafford. And obviously there've been high profile cases abroad and elsewhere in the country. It's another challenge that we're trying to manage as best we can. So, I mean, yes, I agree with you. Ask My GP has been extremely useful to deal with the levels of patient need at this point in time. I think it does throw up some huge challenges, particularly for safeguarding. When we're doing video and telephone consultations, you don't always know who could be in the room listening or even scripting the interaction that you're having with the individual at the other end. So I think that's been another thing we've tried to keep in the limelight and the radar, and having a low threshold to meet people face to face, or possibly to meet people in safe scenarios, or ring them back when they're out going to the supermarket or out for their daily exercise, to try and get around that issue. Sadly, we know nationally that there's been a huge spike in domestic abuse. And again, I guess it's not that surprising when families are locked down under economic pressures and stress. And if there is a situation where control and coercion can happen, suddenly that perpetrator is a lot more powerful. So we're aware of that. We're trying to have that on our radars to pick it up and reach out and offer help for people who need it. Also, huge issues with people having healthy lifestyles. People's hands up. People's diets have slipped. We've gone for comfort eating. We've maybe not taken as much exercise. Diabetic patients, the control isn't so good. And obviously physical and mental health is closely linked. So I think if people aren't having physically healthy lives, often their mental health suffers as well. So yeah, I think lots of challenges to our consultations. We're not seeing so many people face to face. We can't see their facial expression. We can't see their body language. We're missing some of those non-verbal cues. We've got to do our best. We've got to balance all the risks and the pros and cons and try and navigate this as best we can, I think, really. So I guess a lot of what we've been talking about has been quite challenging and difficult. So have you got any sort of positive things that we can maybe lift the mood a little towards the end of our chat, Chris?
Thank you, Debbie. So I think I can only speak from a primary care perspective, and I'm sure that many teams in many different areas of public life have had some really good examples of people working together and stuff like that. But I was really impressed in April, May, when it was all very new and very unknown, how certainly where I work, and I'm sure in many GP practices, people just went the extra mile, got stuck in, cancelled holidays, worked Easter weekends and things like that, so that people were looked after. There was a real sort of nice unifying feeling, really, and it was great. People were innovative. People were very patient with each other as new things came in, and we're going, oh, what happens? We helped, and I think so. That's been a positive. Clearly, there's been lots of negatives in the last 6 months. I think use of IT is, I'm sure with many colleagues in the public sector, we've used IT better so that we're not traveling between practices for a meeting. We're having an online meeting like this, a Zoom meeting or a Teams meeting. That's been a positive, and I think I'm now not going to end on a positive. I think this time, as things are getting worse, though, in common with many other teams, I'm sure people are just weary. People haven't sat on a beach for a week like they normally do every summer, or whatever they choose to do. And I think my concern is really to try and help support colleagues. So when colleagues are well enough to be at work, they're supported, and when they're not well enough, they go and get their own help, and they take time out so that they get right before they come back to their roles. And I think that's my main concern at the moment is not only do we have a service to deliver and people to look after, but our own workforce, we just need to supportively help those to be present when they're well enough, but when they're not well enough, that they go and get the help that they need. And so that's what I wanted to say, really.
That's brilliant. I mean, I think that is a positive. It's saying we've got to maintain our well-being and sustainability to see each other through what's going to, I'm sure, be a very challenging winter ahead. But I think that is a positive, Chris. I think, we need to be self-aware. We need to look out and reach out to those around us. So I think that is a positive note to end on.
And just to be kind to the people around you. So when you get a slightly terse phone call from someone else, that you just understand that they're under pressures too. And if I can just try and be a bit kinder to those that I'm dealing with professionally as well as with patients, then that's what I'm going to try and do. But there you go. So thank you, Debbie. That's been helpful. Thank you, Jake. That's all we wanted to say. And I hope that's been useful for everyone today. Thank you.
Thank you. Bye-bye.
Bye-bye.